My name is Patricia Carreira. I am from Madrid, Spain, and I am a rheumatologist. And for me, it's a pleasure to be here today, to be invited. And also, it's a great pleasure to introduce you to Professor Alan Tyndall. He has been working with Scleroderma patients for so many years, and probably many of you know them already because he had been always so much involved with patients and with the care of the patients. And I have to tell you that he is one of the best researchers in this world of Scleroderma.
She is much too kind. Dear colleagues, dear patients, it's a difficult task for me to talk to you about problems that I've never had. The kind of problems that you face are bigger than anything I've ever had to face in my life. And I don't really know how it is for you to cope with this, but you do, and I admire you very much. I've been given a very difficult task because I think you all know that there is no magic solution for your problems concerning the face. And also, the concept of self-esteem, how you feel about yourself, is a very complicated area. I'm not a psychologist, but I am a human being, and at the end I'll talk to you about what people know about self-esteem and self-confidence. When I was training, and I think Patricia would agree, there was an atmosphere of nihilism about scleroderma. There was nothing you could do. You go to the doctor, he says, live with it. That has changed. For instance, I was taught, I don't know about you, Patricia, but I was taught that you never, ever, ever operate on the accumulation of calcium because it would only cause more problems. This is not true. 30 years ago, it was true, but plastic surgery has improved enormously. So yes, I take off these painful, nasty-looking calcifications, and my patients are very happy. I work with a very good plastic surgeon who I know for 20 years, and I know he does the right thing. However, in the last 10 to 15 years, there has been an explosion of therapies for beauty. We have to all be perfectly beautiful. Not many people, apart from Patricia, Annie, and most of you sitting here, are perfect. Most of us have to live with what we have. However, these centers offer you treatments which are sometimes very unrealistic. And that's why I say my talk, I hope, is realistic, but optimistic, because I believe in being a therapeutic optimist. Try things which are not dangerous but might help. So with that introduction, I'd like to, in the next just 10 minutes, talk about problems with tight skin on the face, wrinkles around the mouth, small mouth and all the problems, the telangiectasia, these red spots, you know, and then at the end, what is self-esteem? How do you do that? Now, most of, I'm sure you know much more about this than I do, because on the internet, you can find hundreds of centers which offer you these fat treatments, or fat transfer it's called. The proper name is adipose-derived, that means from the fat, cell-assisted lipotransfer. And the technique is very simple. You take liposuction, like is done for beauty surgery. You then digest this product. It's just fatty material with many cells in it. Then you spin that down, and you get a bunch of cells at the bottom, which are very mixed. You see there's all sorts of different cells. Some of them are cells involved in making fatty tissue or blood vessels, or still just primitive cells which can make any kind of tissue. But I want to tell you very clearly, there are no stem cells here. And you will hear people talk about stem cell therapy. These are not stem cells. They are very early progenitor cells. They cannot do everything for every tissue. And then there's a very important principle here which you must understand as patients. Once you have these concentrated cells from the fatty tissue, you can either inject them into the skin, or you can put them on a culture plate in the laboratory and grow them and make them expand and expand. And from several 100,000, you can have millions of these cells. This is called expansion. It requires a major laboratory facility. It's called good manufacturing practice. The regulations are extremely strict and very rarely respected. In America at the moment, the FDA is pursuing a case against a company called Celtex, which offers patients these cells expanded in their laboratory, injected back into the patients, and there is no documentation on what happens to these cells. These cells can be turning into other kinds of cells. They don't exist in the human body because they're made to expand outside the body. So this area is very exciting, and I do work with some companies working with these cells, but it has to be highly and tightly regulated. Otherwise, you receive a product which no one knows what's in it. In Italy, there was a major scandal recently with a company called Stamina, was injecting these cells into patients, little children with brain disease, and the government prevented that. So most of the centers offering you these cell-assisted fat transfer are dealing with just unexpanded cells from the fat. Now, I'm very grateful for my colleague and friend Nicoletta Del Papa, who's here. She told me she wasn't coming, but she turned up. I'm pleased. And I'm pleased because she actually has a lot of experience using these cells as unexpanded, collected from the fat, done under very good laboratory practice, and then injected into the patients around the mouth and face. And Dr. Del Papa has published this recently. And these are pictures from her patients. You can see baseline, where are we? Baseline and 1 month later. And I'll ask actually Dr. Del Papa to talk about this for a few minutes afterwards, because this is her work. And mouth opening improvement, as you can see. Wrinkles and plasticity of the tissues around the mouth improved, but look at the periods of time. 3 months, 3 months, and 3 months. And before I knew Nicoletta was coming, she said, when you present this, please remind everybody that this may not last a long time. Now, we do know that. With lipofilling or lipotransfer, it can be fine for a while, and then it slowly gets resorbed into the tissues. Doesn't have to, but it can. So these short-term results are great. It's great, but it may not last for a long time. Now, I've concentrated my talk on systemic sclerosis, but of course for people with hemiatrophy of the face, this linear form of scleroderma, especially a young person, a teenager, a child, it's dramatic to have these defects. And so lipofilling in these cases can be, even if it's short-term, it can help the child develop their personality and self-esteem. So what I can say is that there's variable persistence due to resorption, but you may be able to improve that by enriching the graft with properly expanded these stem cell, these stromal cells from the fat. You can increase the duration of this, and this is an area that I'm working with a company called Tygenix and others, and this looks promising, but it's not a miracle cure. It just extends the period of replacement. You can have bad results with asymmetry if the surgeon's not experienced. Unrealistic expectations are always an issue. It costs a lot, and very few health insurance systems pay for this. And if you don't control the underlying systemic disease, probably the thing comes back. Now, moving to phototherapy, we had a question about UV therapy. And as Professor Matucci said, it's this UVA1 wavelength therapy which penetrates deep into the skin. And this is just one of a very nice review of this, a concise and practical review it is for doctors. So this therapy is, of course, standard of care for several skin conditions, including scleroderma. And here's a case. This is a published case from London of a girl with systemic sclerosis who has, now look at this, 40 treatments lasting over a year. This is a long-term commitment. But she did improve with mouth opening. This is 1 year. But how long will this last for? We really can't be sure. But the therapy itself is relatively free of toxicity. So this is also a possibility. But again, as Professor Matucci said, this must be done under the supervision of an experienced center, and they are usually dermatology centers. I work with the dermatologists and with the plastic surgeons. Now, the small mouth is really an issue for you because it leads to other problems, just biting into a piece of fruit or cleaning your teeth and so on. You know that. And this is a review for doctors, which I thought was great, and I've sent it to some of my colleagues. Small mouths, big problems. And the problems are mainly dental. And I'm sure you realize that many people are insured for health, but not for dental care. And I spend quite a lot of time writing letters to the health insurers saying, my patient with scleroderma or my patient with Sjögren's syndrome, their dental problems are part of their disease. It's not just dental. And about 50% of the time, I'm successful, and the insurance company pays for their dental care. But there are many problems with scleroderma, small mouth, and the dryness that you sometimes have. For instance, increased caries, resorption of the bone, and just making a simple implant can be very, very difficult. Example, this is a normal dental impression to have an implant. You put in a large mold and you bite on the plastic, and we know that. But how can you do that if you have a small mouth? Well, now there are these very nice machines which can do this without opening your mouth. So this is called digital impression method. So the computer generates the shape which the laboratory has to make for your prosthesis. So you don't have to open your mouth at all. So just an example. Now, the message here is I'm not a dental surgeon, but I know the good surgeons who understand my patient's problems. So your rheumatologist or your doctor must know a dental surgeon or a dentist who is up to date on these issues of dryness, caries, and so on. What about these spots on the face? Well, there are several techniques. One is they're both basically light-based. You can either use this intense pulsed light, which is a flash, or you can use a laser, and I'm sure you know that. The results are pretty much the same. I'll show you. Here on the left we have the intense pulsed light therapy, and on the right we have the dye laser therapy. Pretty much the same after 16 weeks. There are more side effects with the laser in terms of reaction with inflammation and pain, but the results are pretty much the same. Again, if you do not control the main disease, then of course these things may come back. But it's something to offer, and from time to time, especially young girls who really just can't look in the mirror and see these spots, my plastic surgeon we use more the pulsed dye laser, and the results can be quite good, but without any promises. I'll just finish just a few words about self-esteem. What is self-esteem? There was a gentleman called Abraham Maslow, who was a psychologist in the late 40s, early 50s in the US. And he tried to work out what is it that makes us happy. Well, some people say, I want to be rich and gorgeous and have a sports car and holidays in the south of France. Well, he said, no, this doesn't actually make you happy. You need to be healthy. You need to have some money. You need friends and family. But even now, this is not enough. Here comes self-esteem and confidence. But even then, that's not the major thing. Up the top of this pyramid are things like morality, creativity, things that you forget sometimes when you have problems here. And while I was researching this, I found one of my idols, Brad Pitt. What I would give to look like Brad. But Brad suffered terrible depression. I've never had depression. But Brad is wealthy and gorgeous, and he suffered terrible depression. Interestingly, Maslow said this pyramid is wrong. I've forgotten something later. What he said is, I forgot that the absolute transcendence of happiness is to help other people, to give yourself. And Brad Pitt discovered this when he was filming in Casablanca. I don't know if you've seen that movie, but while he was filming, he was extremely depressed, and he saw the poverty and misery of these people in Morocco. And together with Bono, his friend, they started doing charitable concerts, and he feels that this is what gave him his final self-esteem and happiness. Not his lovely face, not his millions, but giving to somebody else. And I think this sometimes, I have to think about that. As I said, I've never had a big problem, but when I do have a few problems, my son, who's an amateur astronomer, he's a doctor, but he loves looking at the stars, and he says, Dad, look at this. And he sent me this. Dad, you're here. Forget your problems. We're just a tiny, tiny speck in one galaxy of billions of galaxies. So I'd just like to finish by saying thank you for your attention, for your trust and courage, and you do inspire me to keep going. Thank you.
Dear Professor, thank you very, very much for this impressive lecture. And you gave us some hope, because the majority of the patients suffers from facial changes, and we would like to have the change back as soon as possible. Thank you so much. And now let me introduce you Maureen Sauvé, who is the former president of the Canadian Scleroderma Association. Dear Maureen, please give your speech.
Good afternoon. Scleroderma has brought many challenges and changes to my life. Probably the biggest challenge is dealing with the fear of progression. What's going to happen? How bad is it going to be? I remember clearly the day that I first noticed changes in my face. I was scared. I was really freaked out. I called my sister, cried on her shoulder, and really just had a giant little pity party. Scleroderma was stealing my identity. How could I look at my friends and family the same? How would they look at me? How was I going to cope? I did something really strange at that moment. I pulled out a bunch of photo albums and started looking through. And suddenly it struck me. My face had been changing my whole life. There were pictures of me as a baby with these big fat cheeks, no hair, no teeth. A little later, the gangly teenager with the twiggy hair and the giant zit on her chin. Had to cancel that date. And then in my 30s, beautiful skin, big, big hair. And when my daughter, when I went through fertility treatments, the pictures for those time frames, when the drugs had swollen my face, I was all puffy. And then again later, as these changes slowly, as I looked at these pictures, I slowly saw the changes. Now, you know, facial changes aren't new. It's not new to me. You don't have the same face for 40 years and then one day it's different. It's an evolution. And the evolution of my face told me one thing. That in every picture I was smiling in, I looked better. This trip down memory lane gave me something so important at the time, and that was perspective. Scleroderma had stolen a lot from me, but there was no way it was going to steal my confidence. People age, they change, their faces change. I'm different because of my disease, but my face would have changed anyway. Scleroderma wasn't stealing my identity, my insecurities were. There's a truly great commercial done by Kellogg's that I'd like to share. I think it says it so well, and I quote, "Fact, 97% of women have an I hate my body moment every single day." Think about that. That's a lot. Most of us looking in the mirror and wanting to change something. Boobs, skin, arms, legs, hips, hair. We believe that 100% of women can change something more important than the size of our butts. We can change our perspective. What if we tell the voice inside of us that says we're not good enough to shut up? Let's focus on the stuff we can change. What if we were nicer to ourselves and put good things in our bodies? Let's take a good look in the mirror at the good and the not so good and proudly own it. In closing, I want to share something that my husband said to me for 35 years. The most beautiful thing you wear and the most beautiful thing about you when you walk in a room is your smile. Show the world that you are beautiful. Own it and smile. Thank you.
Thank you very much, Maureen. Thanks a lot. And now let me introduce you, Sandulescu from Romania. She's the president of a very young Romanian Scleroderma Association.
Hello. Thank you, Fesca, for inviting me to speak about my story. So, I was born just like everybody else, a normal baby. Had a normal life until my 16 years old when I got ill. The verdict came from a doctor who said to me that I suffer from Scleroderma, that my skin will become very hard, and my skin will look like a crocodile skin. So maybe I will be lucky to go to my 30 years old and walk and be some kind of normal. So my questions were about, wow, what will happen to me? How do I look? So I imagine like this. This was my first imagination of my skin, and how will I look over a year or two with a pocket and my crocodile skin and not being able to move. So I started to worry about my face, my aspect. So will I be able to dance anymore? Will I be able to go to school? Will my friends run from me? Will they look at me like some kind of human, I don't know, thing? And with the help of my family, my friends, and the doctors, I understand that there is life with Scleroderma, and a good one. And after that, it was a long period till now. You can look that it has been passed over many, many years, just 18 years. And I understand that it's about my way of thinking about Scleroderma and my determination of winning, my optimism. And apparently I'm normal as everybody else. I'm just being me. And I live to see that is a great life that everybody can have. And life is amazing, and I'm enjoying my ride through life, and hoping you do as I have, and I will. And maybe someday I will come and speak about my baby and my family, as my colleague said earlier, with her new baby of 4 months. So thank you very much.
Thank you, Sylvie. I wish your dreams come true the soonest. Before any questions, I would like to share with you a very important information. And the dinner, who are coming to the dinner, is tonight, not tomorrow, tonight at 7:30. Please read outside the address of the restaurant. You can make a photo of it, or you can just note it. So it is today, not tomorrow. So see you in the dinner later. And now, if you have any questions, short one, because we are a bit ahead of time. Do you have any questions to Professor? No questions. So thank you very much for the attendance.